Welcome back, Deep Divers. Today, we're going deep, really deep, into a topic that's close to many of our hearts, I think. We're talking about how to make those really tough decisions about feeding someone we love who has dementia.
Yeah, this is a really sensitive area, isn't it? Lots of strong feelings.
Absolutely. It can be a real emotional minefield, right?
Yeah.
Full of choices that feel impossible, with no easy answers. And we really want to be sensitive to everyone going through this. But, we got to look at it. We got to look at the medical facts, the ethics, the human side, the whole picture.
It is fascinating, I think, where healthcare, medicine bumps right up against our personal values.
Right.
And how those change as dementia progresses. It's not just memory that's affected.
Right.
It's doing basic things, even eating.
Yeah, just getting food in.
And that's where surrogate decision makers come in.
Surrogate decision makers. Now, who are we talking about here?
So these are the people who are, making the healthcare decisions for someone who can't do it themselves anymore.
Right.
It might be family, maybe someone named in a healthcare power of attorney, or a guardian assigned by a court. And their job, their role, it's massive, huge, because they're making choices based on what they think the person with dementia would wanted, based on, their values, their wishes, their quality of life.
Yeah, that makes sense. So before we even get to the options, right? Let's just take a step back. Dementia, it affects the ability to eat in a lot of ways, right? It's not just, oh, I forgot to have lunch.
Exactly. It affects cognitive function. And that includes eating. It's not, it's not a light switch. It's gradual. It's this process where, using a fork is hard, swallowing is hard. You forget to eat. You lose your appetite. You get agitated at mealtimes.
Yeah, it's a whole cascade of things. Yeah. So, okay, someone's showing these signs. It's getting tough for them to eat. What are our options then to make sure they get the nourishment they need?
So, broadly speaking, we've got two main paths.
Oh.
Assisting with eating, by mouth.
Okay.
And then there's feeding tubes. And each has its own, its own considerations, benefits, and drawbacks.
I imagine assisting with eating, that's probably what most people are already doing, right? If they're caring for someone.
Yeah, it's that intuitive approach. It's just, supporting someone to eat orally, reminding them to eat, encouraging them to take bites, maybe changing the food texture.
Making it easier to swallow.
Exactly.
So it's all about managing the experience, both for the person with dementia and the person who's caring for them, and who usually provides that assistance.
It's often a mix, isn't it? It's family, it's friends, and then, of course, trained healthcare providers like nurses and aides. Even volunteers can help if they've got the training.
That's great. So it really does take a village. But let's be real. This approach, it must be really time-consuming. And maybe even a little inconsistent, depending on, who's available to help.
You've hit on a key point. It is time-intensive, and it's not always easy to keep that support consistent, especially as the dementia progresses.
Yeah, it gets harder and harder. So at what point do feeding tubes enter the picture? What are they exactly, and how do they work?
A feeding tube, it's a way to deliver that nutrition, right to the stomach.
Okay.
It bypasses the mouth and the esophagus. So it's a medical procedure. A tube's inserted through the skin into the stomach.
Right.
Usually they use medication to relax the person, imaging to make sure they get the placement right, and then local anesthetic to numb the area.
Okay, that does sound a bit intense. Are there risks with this procedure?
Like any medical procedure, there are.
Yeah.
But it is generally considered safe.
Okay.
Some common side effects, you might see nausea, diarrhea, maybe a minor infection at the insertion site. Rarely, more serious complications can happen, but thankfully they're uncommon.
So, okay, the feeding tube's in place. How does the feeding process work?
So a special liquid, it has the nutrients, medications, water, all that stuff. It's delivered through the tube. This could be done at regular intervals, like meal times, or it can be a continuous feed. All depends on the individual's needs and their medical condition.
So that must take a lot of coordination and monitoring, right? Who's in charge of making sure it's all working correctly?
You're right, it does require some expertise.
Yeah.
Nurses usually play the main role in monitoring the tube, making sure it's clean, dealing with any issues that pop up. But with the right training and support, caregivers can learn to manage a lot of it at home.
That's great. And I just want to take a quick moment to thank London Heartbeat Disease Academy in the UK for their support on this episode.
They're a fantastic resource.
They are. If you want to learn more about dementia care, and they've got over 150 courses on all sorts of health topics, you can find them on Facebook, Instagram, Spotify, and YouTube.
Subscribe to their channels. Don't miss out.
Yeah, you don't want to miss their amazing discussions. So now back to feeding tubes. I know there's a lot of misconceptions around them. For example, do they actually prolong life in people with dementia?
That's a common belief.
Hmm.
But research just doesn't support it. Studies have consistently shown that for individuals with advanced dementia, feeding tubes don't extend their life expectancy.
What about the idea that they prevent aspiration? When food or liquid gets into the lungs.
Unfortunately, not always true. While the feeding tube bypasses the mouth and throat, there's still a chance of aspiration happening.
Oh, how's that?
The contents of the stomach can reflux back up, and if that happens, it can still get into the airway.
Wow, so much to think about.
Yeah.
This is way more nuanced than I think people realize.
Exactly. And before jumping to conclusions about what's quote-unquote better, we need to look at the individual's situation,
Right.
their values, their quality of life, all of it.
It's about the whole person.
Yeah.
This is all so insightful. I really appreciate you breaking all this down for us. But we've only just started scratching the surface here.
Yeah, we've got lots more to cover.
There's so much more to explore, especially when it comes to the actual decision-making.
Absolutely. That's where things get, well, even more challenging. Emotionally, ethically.
For everyone involved.
Making these decisions about feeding someone with dementia, it's never easy.
Yeah.
It's deeply personal. You have to think about so many things. The individual's wishes, their quality of life, what are the benefits, what are the burdens of each option.
Yeah, I bet these conversations, they can get really emotional, really tough for families.
Oh, absolutely.
So where do you even start with something like this?
Well, a good starting point is to think about whether the person, have they ever talked about feeding tubes?
Okay.
Maybe in conversations about end-of-life care or in an advance directive, like a living will.
And what if they haven't, explicitly said what they want? How do you make that decision for them?
That's when it gets really, really hard. You're trying to figure out what would they choose based on, what you know about them, their beliefs, their values, how they live their life. And it's also about their current quality of life. Are they still enjoying meal times? Are they in pain or distressed when they eat?
So it's a balance,
Yeah.
right? Between what they would wanted and what's best for them now, even if they can't tell you.
Exactly. And that's why those conversations, open, honest conversations with family, with healthcare providers, everyone involved, they're just so important. You've got to bring all those perspectives together and try to make a decision that feels right, that feels aligned with the person's values and their well-being.
Let's dig into these feeding options a little more. We talked about assisting with eating by mouth.
Yeah.
Can you give us a picture of what that looks like, in real life?
Sure. So imagine, someone with dementia, they're starting to have trouble with utensils or they forget to eat. Assistance might start really simple. You set up their meal, you cut their food into smaller pieces, you remind them to take a bite. Right. Little things like that.
So you're just making the experience more comfortable for them,
Yeah.
less overwhelming.
Yeah, exactly. As the disease progresses, you might need to do more. You might need to, hand feed them, help them with each bite.
I could see how that would be. I mean, on the one hand, it's really caring, really intimate,
It is.
but it must also be really demanding.
It is. For both people.
Yeah.
The caregiver needs a lot of patience, empathy, understanding.
Mm.
You want to make mealtimes positive, supportive. It's about the connection, not just, getting food in.
And you mentioned before that this approach, you might need to adapt it as the disease progresses. What does that look like?
As swallowing gets harder, speech therapists, occupational therapists, they can help.
Okay.
They can suggest ways to change food textures, how to position the person when they eat, techniques to prevent choking. It really becomes a team effort.
So it's not all on the caregiver.
Right.
It's about working with the medical professionals to keep the person safe and well.
Exactly. It's about that comprehensive care that addresses all their needs, physical and emotional. Now, let's switch gears a bit and talk about feeding tubes. We've covered some basics, but can you walk us through what it actually means to have one? How does it change daily life?
Yeah, I think that would be helpful to really understand what that experience is like for both the person with dementia and their caregivers.
So when someone has a feeding tube, that's their main source of nutrition and hydration.
Okay.
It's that liquid formula going right into the stomach through the tube.
So is it constant? Are they always hooked up to it?
Not always. You can do feedings at intervals like meals,
Okay.
or you can do a continuous slow drip. It just depends on the individual's condition and how well they tolerate the different schedules.
I bet it takes some getting used to for both of them.
Absolutely. There's a learning curve for managing the tube and adjusting to this new way of feeding.
So what does that look like, that adjustment?
Well, caregivers need to learn how to prepare the formula, how to give it, how to flush the tube so it doesn't get blocked, how to check for infection or irritation around the tube site.
That's a lot.
It is, especially on top of everything else they're dealing with.
Yeah, exactly.
But with training, with support from healthcare professionals, caregivers can, they can learn to do all this.
And what about the person with dementia? How does having a feeding tube affect them, their daily life, their comfort?
That's such an important question. Feeding tubes, they can give that necessary nutrition, but they also come with challenges. Some people might find the tube uncomfortable, even distressing, especially at first.
Are there ways to make it better, to ease those discomforts?
Yes, definitely. Healthcare providers can help, secure the tube properly, prevent skin irritation, and deal with any anxiety or agitation. The goal is always to balance the need for nutrition with the person's comfort and dignity.
So it's not just about keeping them alive.
Right.
It's about their quality of life.
Exactly. It's a complex decision, and it needs a thoughtful, individualized approach.
Now, I'm curious about the social and emotional side of feeding someone with dementia, both with assistance and with a feeding tube. How does that change the dynamic between them and their caregivers?
That's a great question. Meal times, they're often social rituals.
Yeah.
Times to connect, to share. When someone needs help eating, that changes.
How so?
Well, with assistance, the caregiver takes on a bigger role.
Okay.
They might guide the person's hand, prompt them to take bites, even feed them directly. It's caring, but it also shifts the power balance.
That must be hard to navigate.
It can be. For the person with dementia, there's that loss of independence, of control, that can be frustrating, difficult. For the caregiver, there's this huge sense of responsibility and this need to be sensitive to the person's feelings, their dignity.
Sounds like communication is key here.
And
And empathy.
absolutely crucial. You want to preserve the person's sense of self, their preferences, even as their abilities decline. Meal times, they should still be enjoyable, meaningful, even if they're different.
And what about with feeding tubes? How do they affect the social, emotional side of meals?
They can create a distance.
Oh,
Less direct interaction, more focus on the technical stuff.
I could see how that could make the person feel isolated.
Yeah. Caregivers need to be mindful of that and find ways to maintain that connection.
So what can they do?
It could be simple things. Sit with them during the feeding, talk to them, read to them, play music they like. Just offer comforting touch. Even if they're not eating by mouth, they can still benefit from that social and emotional connection.
Right. It's a reminder that caregiving, it's more than just the physical needs.
Exactly.
It's about the whole person, their emotions, their spirit, their connections.
Especially for people with dementia. They're losing their cognitive abilities, their independence. We have to do everything we can to preserve their dignity, their sense of self, their connection to the world.
Now, let's talk about something that's always difficult to talk about. End of life. How do feeding decisions play into end-of-life care and planning?
This is where it gets even tougher, even more emotional. As dementia progresses, you reach a point where swallowing gets really bad and people might stop eating and drinking altogether.
What happens then? Are feeding tubes the automatic answer?
Not necessarily. You see, refusing food and fluids, it can be a natural part of dying. Not just with dementia, but with a lot of illnesses.
That's not something most people realize, I think.
It's a hard concept because we associate food with life, with survival. But at the end of life, the body starts shutting down. That desire to eat and drink, it fades.
So using a feeding tube, then, it might not be what they would want.
Exactly. The focus shifts to comfort, to making the person as peaceful as possible as they near the end.
So what does that look like, that comfort care?
It might be keeping their lips and mouth moist, offering little sips of fluid if they can swallow, managing pain, other symptoms, just being there with them, creating that peaceful, supportive environment.
Sounds like a very holistic approach. Not about prolonging life no matter what, but about making sure they're comfortable.
Right. It's about honoring their journey, letting them transition peacefully, You need to understand the dying process and be willing to let go of our ideas about what care means at that stage.
This has been so insightful. But I want to go back to the decision-making for a second. We've talked about the factors, but are there any tools, any resources that can help families make these choices?
Absolutely. There are decision aids, there are resources to guide these conversations. Some organizations even have workshops, support groups specifically for families dealing with this.
So they don't have to do this alone.
No, they don't. You can reach out to healthcare professionals, social workers, clergy, anyone you trust. There are people who understand, who can help.
And we're almost out of time, but I want to touch on one more thing. Self-care for caregivers. This is heavy stuff.
Oh, it is.
Taking care of themselves is so important.
Absolutely. Caring for someone with dementia and then making these decisions, it's draining. Physically, emotionally. Caregivers have to prioritize themselves, find support, do things that help them cope.
What are some things they can do?
Anything that recharges them. Taking breaks, doing hobbies they enjoy, connecting with friends and family, being in nature, exercise, meditation, journaling, those can all help with stress and emotional well-being.
So it's about realizing if they take care of themselves, they can take better care of their loved one.
Exactly. It's not selfish, it's essential. You have to fill your own cup before you can fill someone else's.
Well, we've covered a lot today. Thank you so much for sharing your expertise on such a sensitive, complex topic.
It's been my pleasure. It's important to talk about these things.
It really has been so much to think about. As we wrap up, I'm wondering, can we sum up some key takeaways for our listeners? What are the most important things to remember when facing these decisions?
Yeah, definitely. I think the biggest thing, the overarching theme, is individualized care. There's no one right answer when it comes to, feeding someone with dementia. What works for one person might not be right for another. It's about truly understanding their individual needs, their wishes, their quality of life.
It's so easy to get caught up in the medical side of things or what other people think you should do. But at the end of the day, it's about that person.
And these decisions, they're not, black and white. They're heavy. There's so much emotion tied up in them. You're trying to do what's best for them while still respecting their dignity, their right to make choices.
It's letting go of the idea that there's one right answer and just accepting that it's complicated.
Exactly. And if I could give one piece of advice to families, it would be have those tough conversations early on.
Yeah.
While the person can still, share what they want.
Advanced care planning, so important.
It really is. It takes some of the pressure off later when things get more urgent.
And just as important, remember, you don't have to go through this alone. There's your family, friends, healthcare providers, support groups.
Yeah, there's so much support out there.
Don't be afraid to ask for help, to lean on people. It's okay to share the burden.
There's strength in that.
Yeah.
And, even in the midst of all this, there's still compassion, connection, even moments of grace.
Beautifully said.
Yeah.
To all our listeners out there facing these tough choices, I want to leave you with this. Trust your gut, lean on your support system, and most importantly, lead with love. The way forward might not always be clear, but if you approach these decisions with compassion and respect, you're honoring that person. You're giving them the best possible experience.
And remember, making these choices, it doesn't mean you love them any less. You're doing your best in a really, really difficult situation.
Thank you for joining us for this deep dive into the world of feeding decisions in dementia. We hope this conversation has brought you some clarity, some comfort, maybe even a sense of, that you can do this.
It's been a privilege to be a part of it.
And until next time, keep exploring, keep questioning, and keep diving deep.